This presentation is approximately 30 to 45 minutes, and I encourage you to submit your questions in the chat box. And at the end of the webinar, we ask that you complete the survey. And now for our presentation, medication management and how to engage the ASC staff as a risk manager, and how we can keep our jobs at risk manager. I was at a conference recently, and I was speaking with the risk manager, and she confided in me that she recently changed her risk manager. And I said, "You changed your risk manager?" And she said, "Yes." And I said, "Well, why?" She said, "My risk manager was not engaging with my staff, and she was just not engaged." What my risk manager did, they reviewed the incident report, does the annual report, minimal education to my staff. And for my facility, I wanted to have more of a hands-on approach with our risk management program. And basically what she said, the risk manager hung her shingle and thought that was it. But as risk managers, there's so much more that we can do. What if we empower our risk managers? We can help our staff by engaging with them, empowering them, and supporting our staff of the facilities that we serve. And you may say, how can I help my facilities or the centers that I work with, that I'm responsible for as a risk manager? Well, here are some examples of how to engage. The first one is through education, by inspiring the surgical centers we serve. We can go above and beyond and minimize the risk that can lead to incidents. And we can do that by offering education to the staff, becoming more visible to them, letting them know who we are, and being a resource. And being a resource means we can offer the staff education. And of course, a big one for me as a consultant pharmacist also is to manage medication in the facility in relation to risk, because that is a huge area of risk. And you may say, why is this important? Why is engagement with the staff so important? Well, it's important to advance the practice of healthcare risk management and patient safety in Florida or whatever state we practice in by engaging with the staff. Everyone in the surgery centers that we serve, their role is important, from the receptionist, who should always have a smile on their face to greet the patients, and when they answer the phone, to have a smile in their voice. There was a facility who had a nurse who had recently started, a recent hire, and the nurse's attitude was not good. And I say not good because she was constantly comparing roles of what they did at the hospital, which she came from, versus what they had to do in the surgical center. For example, she would say, well, why do we have to do it this way? We don't do it like that in the hospital. And so after a while, it took a toll on the other staff members in the center. And fortunately, the administrator picked up on this attitude. This nurse was not following the protocol for discharging of the patients in relation to surgical center. But thankfully, the administrator was engaged and witnessed what was going on. And fortunately for them, the employee decided to leave and seek employment elsewhere. The good news to that is that the staff were engaged with each other and morale increased. And so it's very important to engage. And what I believe is that a staff that is highly engaged is a staff that can deliver the best patient care, while misaligned staff can make huge mistakes. Part of our job as risk managers is to be aware about medication management. So I would like to park here for a few minutes and talk about that. What are some of the risks and how can we help our ASCs overcome those risks in the medication management process? And as a consultant pharmacist, I would like to educate you on the medication management process. So you may ask, what are the inherent risks in the medication process? And what is medication management? Medication management addresses the institution's medication processes. And those processes are based on the care that's delivered in the facility, the type of treatment that's offered, and the services that are provided by the facility. And all those factors enter into how medication is managed in the facilities. What is medication administration process? And what are the steps in this process? For our purposes here today in this presentation, I will share with you 5 steps. It's not all inclusive because I do not want to bore you. So this will be very quick moving, just to give an overview of this process. So for our purpose today, we'll be covering 5 steps. And the first step in the medication management process is planning. Planning the medication, what comes in, procurement. The third step is storage. The fourth step is the preparation of the medication. And the fifth step is administration. Planning is very important, and that is the first step in the medication management process. And with planning, we have to consider the policy and procedures, the formulary list, what type of drugs we're going to have in the facility. We must have a consultant pharmacist, that's per the law in Florida, providing pharmaceutical services, and we must have a pharmacy nurse who's in charge of the medication. What are the risks in the planning process? Well, the medication in the facility, that formulary must be sent to the Board of Pharmacy before the center could open. They need to know the type of drugs you'll be having in your facility. And if there are any changes to your formulary, this needs to be updated annually with the Board of Pharmacy. And the consultant pharmacist would take care of that for you. You must have drugs in the facility that corresponds to your procedures and services that you're offering. So for example, you shouldn't be having a Retin A, it's a product for acne, in an orthopedic center because there's no relation to the two. And that's one way that the Board of Pharmacy, when they come in to check their drugs, they make sure that the drugs in the facility are aligned with the services that are offered. And of course, they can always double check with the formulary list that was sent into the state. The second step in the medication administration process is procurement. When you're ordering your drugs, you want to help your administrator understand that the drugs need to come from reputable wholesalers. Drugs that there are issues with counterfeit drugs and drugs that are not effective. They have had issues with drugs in our drug supply chain where drugs are not effective because they've been adulterated or counterfeit. So it's very important that we get our drugs from reputable wholesalers, that there's pedigree papers involved. There's been some issues with back-ordered medication where medications are not available. Also, recalled medications, we want to make sure if a medication is recalled, that that medication gets pulled from our stock immediately. And there are risks involved also with procurement. The next step in our medication management, the third step, is storage of the medication. When the drugs arrive from the wholesaler, we want to make sure that the invoice corresponds with the product, and there are 2 staff members who check the medications in. And we, of course, want to safeguard the security of controlled drugs. Expired medications should be removed from stock. I know there have been some issues with back order, and some facilities have been keeping expired medications. If you do have that, make sure it is documented and that you have shown good faith effort in ordering these drugs, but you have them on hand, because it's better to have them expired than to not have them at all. High alert medication is a problem, and so it is recommended that these high alert medications should be identified, because they have the potential for serious harm when administered to patients. So, for example, insulin is a high alert medication that should be marked that way. We have a problem with look-alike, sound-alike medications. And one way to overcome that, make sure that your drugs that are high alert are marked that way. There's stickers that's available for that. And that if you have medications that are packaged the same but they're different, do not store them next to each other. Then the 4th step in the medication administration process the area is preparation. The area where the medication's prepared should be clean and uncluttered. Once the medications are reconstituted, they should be checked visually to make sure there are no particulates in the solution or discorrelation or other. If the medication is not administered right away, it should be labeled appropriately. When medication orders are received, if they're by verbal, they should be read back. Standing orders should be signed by the physicians. The 5th and final step in the medication administration process is administration. Again, before the medication can be given to a patient, it must be ordered by the physician and documented, and medication can only be given by the nurse or the physician, and only the physician can change an order. An important thing here is to always check patient's medication allergy before administering the medication. There was a recent case where a patient's chart showed that they were allergic to NSAIDs, which are non-steroidal anti-inflammatory, and those drugs would be like Motrin, ibuprofen, naproxen. However, the patient was given ketorolac, which is also an NSAID, and subsequently had an allergic reaction because the staff member was not aware, or the physician not aware, that ketorolac was an NSAID. So it's very important to check drug allergies and double check to make sure that there are no interactions. The risk in administration, we want to make sure that we follow the rights. I have 6 here. I know there could be up to 8. But for all purposes here, we want the right patient, the right drug, the right dose, right route, right time, right documentation. These are very important and should be done in a very focused way to make sure that all of these parameters are met before a drug is given to a patient. Drug diversion, I'd like to speak about drug diversion. It is a growing risk to patient safety. A USA Today review shows more than 100,000 doctors and nurses, medical technicians, and healthcare aides are abusing or are dependent on prescription drugs. This puts patients at risk. If drugs are missing from their facility center, the law enforcement and the DEA must immediately be notified. Of course, your consultant pharmacist handles that for you. But how can we help as risk managers and administrators in the surgical center? We can help by offering employee education, making sure that the daily counts are being done, that they're accurate reporting and monitoring, making sure that the processes that are in place are being adhered to. There was a story which has been well publicized about hepatitis C outbreak because of healthcare worker. This problem impacts patient safety. And as a risk manager, we can support our centers and letting them be aware of this risk and help them to keep their staff educated, to be on the lookout if there's anything that may seem to show that there's an issue with drug diversion in the facility. I think as risk managers, we're so fortunate, we're in a very good position to help the facilities that we serve. Ambulatory surgery centers is an answer to the growing healthcare needs. My son Forrest, he had an injury on a Saturday night roller skating and injured his leg. And of course, we went to the walk-in and we were referred to an orthopedic. So by Monday morning, we went to the orthopedic doctor. And my son had dislocated his foot actually from his ankle. And he was able to be in surgery by Tuesday morning to get that repaired. And I was so grateful because, you know, in a surgery center, the staff there, they're usually very nice, very accommodating. And we were so impressed with the service that we received. So I feel so honored and happy to be able to serve the surgery center, as I'm sure that you all do. But what can we do as risk managers to help the surgery centers that we serve? We can help our facilities reduce incidents by empowering and supporting our administrators and their staff by true engagement, letting them know we have a lot of knowledge and how we can help them. One of the ways that I believe we can help and support them is to become more visible. When you enter the facility, does the staff in the center, do they recognize who you are? Introduce yourself. Tell them, I am your risk manager. Let them know that you are available to help them. I had a facility where the administrator told me the ARCA inspector will even ask the staff, who is your risk manager? And if they don't know the name, they say, can you describe the risk manager? So you want your staff to be able to tell the state, yes, I know who my risk manager is and her name is, or this is what she looks like or he looks like. It's very, very important. In some facilities, their staff turnover, so it's always trying to re-educate and reintroduce yourself and become more familiar. The ones that's been there for a while will know you, but I would encourage you to reach out to the newer staff members. If you see a new face, introduce yourself, tell them who you are, that you're there to help them, and that you can be reached. How can we help our facilities again? We can use incidents to spark educational opportunities. What are some of the ways we can do this? We can have a 5-minute huddle. In the surgical center, we know it's pretty quick moving, patients in, patients out. The nurses, for the most part, are busy. But you may be able to get 2 or 3 nurses and do a 5-minute huddle. And you may have to do that 3 or 4 times in the facility as the staff becomes available. But you're passing on good information that will help them and help them to feel informed and somewhat on top of things in terms of risk, and just having your support for them. Another way we can help them is by offering a quarterly in-service, which is a little bit more formal. However, that's also helpful, where you could talk to the administrator and find out when is a good time, when they have the staff meeting, and try and coincide your quarterly visits with that, and do a 10-15 minute presentation with the staff, get ideas on having a QAPI study. Another way we can help all centers is through a newsletter. Just a few articles that you may find, not necessarily something you need to create from scratch, but if you come across a good article, you can put a couple articles in a newsletter and give it to them. I'm sure they would appreciate that. Post information on the bulletin board. Pick an area of focus, perhaps infection control, hand washing, and just to remind the staff that you're there and you're supporting them. And another great way I have found to help them is through articles. The Surgical Center periodical, the magazines, they have great articles, and they actually have them in a print format where you could print the articles out, attach it to a clipboard with a sign sheet, and as the staff read the article, have them initial it. At the end of that, you can put that in a binder, and that will count towards education to the staff. Another way of engaging is medication management. We just went through that whole medication management process. Medication is used in a lot of the aspects in surgical center, so it's really important that they're following this process exactly as the policy and procedure manual dictates. And again, education, you can never overstate that. We can always learn more, and I'm sure the facility staff would appreciate it. Another way is, again, to be a resource for the staff. Help them by giving them information. And we just went through several ways how we could do that through articles, newsletters, and posting information on the bulletin board. As risk managers, we have such a huge responsibility and an opportunity to help the surgical center industry. I would suggest one way we can do this to help ourselves and to help our industry is to become a member of the society, attend the conference. I would like to share here, I attended the conference last year. It was very educational. I learned so much. That was truly an engaging conference. Engaging is the word here. This year's conference is going to be great. If you have not yet registered for this year's conference, I urge you to do so. Come on out to the conference in August and go sign up and be empowered, and you will feel so much more engaged after that conference. we empower our facilities by becoming engaged ourselves. As risk managers, what do we care about? We want our facilities and centers to deliver the best healthcare services to the patients that we're honored to serve. Let us disperse our knowledge to them through orchestrated engagement and let them know we care about what they do and how well they do it, so we can keep happy, healthy patients. I have a question for you. Are you an HRMINO? That means healthcare risk manager in name only. With our political atmosphere that we're in right now, I thought that would be an interesting slide to put out. We are definitely not HRMINOs. We are not healthcare risk managers in name only. Let us get out to our practice settings and become engaged risk managers. Let's be a resource. Find out what problem our centers are having. Ask lots of questions. I survey my facilities that I serve often to find out where I can better help them, how I can help them do their jobs better, what resource I can offer them. Make your contact information available for questions of the staff or the administrator. Make it easy for them to contact you. And when they contact you, use it as opportunities to help them. Quarterly reports are an opportunities. Going over incident reports have lots of opportunities. And of course, always encourage them to follow the policies and procedures. I'll be happy to be a resource and be helpful if you have any questions about anything that I discussed here today and how I can best serve you. I would like to thank you for listening to this webinar. Attendees of this webinar today can receive a copy of my ebook, Medication Management in the Ambulatory Surgical Center, and you may send your requests. Email me. My